So the first thing I want to call out and point out is that when we're talking about support, we're talking about um, making sure that people are tied to the right levels of care and the individuals that will be helping them kind of navigate their space, is that it's your support. It's unique to the individual. I can come up here and tell you all these great ways and great things about this is how you find support. And you'd be like, I've tried all of them and none of them worked. And you know what? That would be okay, because it's unique to the individual and what they need. So when you see Just Do You, that is exactly what this is about, because your support is going to be tailored specifically to what it is that you feel as though you need. And I would be very not responsible, irresponsible if I didn't acknowledge COVID's impact over the last 2, 3 years or so, because a lot of people have had a cut or have not been able to access their support networks as heavily as they may have pre-pandemic. I hope and really hope that we're moving past that, but as we see numbers going up again, I think that we still need a little more time to kind of get all these things under control. And, kind of going back to that first point and when fusing it with the third point is that there's not a right answer to your support, right? So I can say, oh, this works for 95% of the individuals I work with as a social worker. And you'll be like, well, I guess I'm in the 5%. So there's no right answer. There are suggestions. I hope that if this has not been something you've thought about, or especially if you've been an individual that's been struggling with the isolation piece that COVID has presented us, that these might be some places where you can start, or start even having the conversation, or just have playing in the back of your mind when you are acknowledging or trying to identify what those supports might look like for you. Okay, so the one thing, and I'm going to get a little touchy feely, so I apologize. I am still a social worker after all. So the first thing, and it's been mentioned, is you want to feel safe in where you're getting your care. So affirming care is a giant hallmark for making sure that people are actually going to, one, be compliant with treatment, as well as being honest and upfront with their provider about the things that might be bothering them. And this is for any provider. This does not mean it's not specific to LGBTQ, and it's not specific to individuals navigating Parkinson's. So I challenge you, the next time that you go to your provider office, or you go through telemedicine, or you even call to schedule an appointment, just tap into how do you feel, tune into how you feel in that moment. Do you feel like even if that person doesn't identify you, or they don't know that you might be LGBTQ plus, do you feel comfortable speaking to the reception staff? Do you feel comfortable speaking to your provider about a vacation you might have lined up with your significant other? And then, of course, also taking into account the other support staff that you come in contact with and other clinicians. So for me, you might talk to me, you might talk to my nurse, you might talk to my nurse practitioner, or you might talk to my fellow or my care coordinator. So, there's a lot of different people that you come in contact with at the office, and you have to make sure that you feel safe, because ultimately that's going to increase your outcomes when you're navigating, trying to get the best care possible for you. And it's been mentioned already, but the Human Rights Campaign Foundation, this is their 15th year of putting out the Healthcare Equality Index. And what this is that it's a grading system that the Human Rights Campaign kind of, grades different institutions based off of their criteria of what would be an affirming place for care. So these are the 5 points that they kind of go over. There's a lot of subsections, and honestly, I would need a book to try and go over all the criteria. But these are the main sections. So we have non-discrimination and staff training. Are the individuals that you're going to see in this medical institution, are they being trained on diversity, equity, inclusion, belonging, justice? Are they being trained on all of these different aspects of how we could most effectively work with individuals who have historically been displaced and mistreated when navigating the medical system? Also taking into account patient services and support. So anything that's outside of sitting down with the actual physician, what other supports does the institution have access to? And are they geared towards people with other identities, whether it be racial or identifying as LGBTQ plus? Employee benefits and policies. So, there's a lot of breakthrough things happening with people being able to have their insurance cover things like gender confirmation surgery and things of that nature. So is that something that the institution is allowing their employees to have access to through their benefits that they're being given? Patient and community engagement. It's all great to have trainings and it's all great to have these other aspects of the care, but what else is happening outside of clinical care? Because we know that LGBTQ plus individuals have to fight for a lot in a lot of different spaces outside of the medical realm. So are we doing our part as providers to make sure that we are engaged with the community outside of the clinic room or the clinic space? And being sure that that individuals are responsible citizens, meaning that making sure that we are, up to snuff when it comes to making sure that we are not regressing. We are using affirmative language. We are making sure that we tune in to how people want to be identified, and we uphold those standards as we go out into the community, and we acknowledge and we make sure that our colleagues, if that's something that they don't have practice with, that we have no problem, I don't want to say checking them, but in a way, making sure that we hold them accountable as colleagues, because the medical realm can be very scary for many people that also possess the LGBTQ or fall into the rainbow acronym, as one of my friends calls it. Okay, so Kimberly Crenshaw has been brought up already. She's a law professor at Columbia, and then she's credited with one of the biggest terms that we use nowadays, which is intersectionality. And I think that intersectionality, it just really plays into literally everything we do. So I'm really grateful to have been invited to speak to you guys, because I do a lot of conversation about LGBTQ plus individuals, how we can be more cultural humility and all the aspects of working with this type of population. But I also do a lot of Parkinson's disease talks and how to show up for those individuals. So to fuse them together is almost like a eureka. Of course, this is the thing. But the reason that I wanted to kind of call out or shout out to Kimberly Crenshaw is because intersectionality just really allows people to take up multiple spaces at once. I am a Black man. I am cisgender. I am queer identified. I have all of these identities, but sometimes it feels like we only can be one in a space. But that's also how we can make this work for us. So when we're looking for support, sometimes we won't find a space that is not that is not welcoming, but we don't always have a space that will allow us to be all of ourselves, or will allow us to be all of ourselves, but it's not specific that it's allowing us to be all of ourselves. So I bring up intersectionality as though it can be something that empowers a person, it also can be an advantage when we're looking for support. And the way that I'm going to say this is that, there are Parkinson's support groups, for example, that lean more heavily towards reaching out to the Black and African American community. That's not to say that they are not affirming of other identities that people bring into that group, but that could be a specific intersection of that person or that individual with Parkinson's or their care partner that they might be able to lean into to get additional support. So I mentioned all of this to say that don't sleep on the other aspects of who you are, because you might actually be able to use that or lean on that a little more to get the support that you might not have otherwise been able to access. So for when we're talking about LGBTQ plus PD plus any other intersection that you may possess, and I think that individuals of the LGBTQ plus community have absolutely done this, going all the way back to Marsha P. Johnson and Stonewall, um, is creating and taking up space. It is important for us to not, sometimes it's difficult for us to be in spaces where it feels like there's nothing for us. But it's not abnormal for us to also create our space. We create our safe space. And we make sure that the people around us know that this is our safe space. So sometimes it requires a little bit of creativity. And you don't have to do it alone. But like it was already mentioned, we're a community for a reason. We have other individuals that we can team up with to help us take up space and help us create. So the burden does not fall alone on one person. Linkage to community organizations and institutions. I know in Philadelphia, we have a slew of different organizations that are LGBTQ centered. There's a lot of supports, there's a lot of different places, but I also acknowledge that people who do not live near a major city, such as Philadelphia, may not have access to these types of organizations. So the one thing that I will say that COVID has allowed us to do is to really lean into and tap into all of the virtual options that we never really, that we might have had access to, but never leaned this heavily into. So I promise if you just do a simple search on the internet, you can absolutely find whatever the closest city is to you. You might be able to find some online events or some online conversations, because people, it's not normal for humans not to connect to other humans. We are not meant to be isolated, and we're not meant to be individuals that don't have other connections with other individuals. So please take advantage of the online abilities that we have now. Even now, and it sounds like most people or a lot of people are presenting from Georgia. I'm in Pennsylvania. So, even allowing us to connect in this type of way, don't sleep on that. That's something that we can use. Attending LGBTQ plus events. So just like I was talking about having Zoom and online events, you can absolutely lean into these other events to find support. Sometimes you can show up for one thing and leave with making a best friend. So absolutely lean into showing up for the community events. But I also want to acknowledge that I do understand that there is a very large population of individuals who cannot necessarily navigate spaces for LGBTQ plus individuals because of issues with possibly coming out, or what other things that might come along with that. And I just kind of want to change the language from coming out to letting people in, only because coming out really puts the burden on the person, and it almost puts it in a space, puts them in a space where they have to now tell everybody who they are when they already were that person. Allowing people to come into your space and allowing people to see who you are and allowing them, you're granting them access to you. So coming out just feels so labor filled, and makes it feel like it's a chore to do. So letting people in, you allow who you want to be in your access and in your network. So I want to make sure that people feel empowered when we have that conversation about who you're letting in is ultimately who's going to be your support network. But I, of course, also acknowledge, like I mentioned, the people who don't, for safety reasons or security reasons, can't naturally or be their true selves in the different spaces that they navigate due to fear. And I also want to lift those people up, because building support around your core identity, or one of the aspects of your identity, and not having the ability to navigate that freely, is something that sometimes we take for granted. Peer mentoring networks. So I know that there are a lot of peer mentoring networks across the world. I know we do it specifically when someone is interested in trying to find someone to help them kind of adjust to diagnosis. We have it for people who are interested in maybe one of the surgical procedures, such as deep brain stimulation. So they can speak to people who are navigating this in real time, or have navigated it prior to them considering this option. So not so being tied to other individuals uh, with Parkinson's that might also share this identity of being LGBTQ plus, might be something that your physician or your medical office might be able to assist with, especially when I know my providers are really good with linking certain personalities or certain individuals to other individuals. So that might be something to inquire about from your medical provider, to see if there are any peer mentoring possible connections that they might be able to make with other patients. Of course, there's a consent process and making sure that both parties feel comfortable with that. But absolutely, I mean, the more people that you can add to your circle, the better. Support groups. And his support groups are always hit or miss with people. And I completely acknowledge that. Um, but support groups are a good space to create that kind of inclusive circle, right? So there's ways that people can come up with inside jokes that very similar to the LGBTQ community, such as there are certain language or certain things and certain inside jokes that we have that we can use, but anybody outside of that, they better not try to use it, because it just is not appropriate. Um, so I just want to acknowledge that support groups can be very beneficial, but I also understand that sometimes they can create some anxiety around navigating the disease and navigating, almost feeling like you need to let those people in as well. But the one thing I will say about letting people in, AKA coming out, is that you have the key to that door. You don't have to let anybody into your whether you consider it your business, whether you consider it your space, whether you consider it um, your safety. You don't have to let anybody in that you don't want to let in. The next thing is mental health providers, which sadly all of us have been social workers, clinical social workers, counselors, psychiatry. We've all been stretched thin, especially over the pandemic. I think that there is a lot of people who may not have navigated mental health, or acknowledge that there might be some underlying mental illness, um, until COVID hit. And that isolation really teased out a lot of things that people may not have dealt with because they were able to either distract them, or they didn't have them until they were isolated. Anxiety and depression being some major ones. But mental health providers, if you have access to one, they are great supports. They are allowing you to have a safe space to acknowledge these things that are difficult um, to kind of process, and they're outside of the circle, right? So you allow them in, but they are not attached to your main circle. So they might actually have some really good insight. And also, I don't think that when I've given talks like this before, that I really leaned into people's faith bases, right? So the community, the church community specifically, has become very, and has been very prominent in many different cultures, specifically looking at, the African American community and the Latinx community. Um, and sometimes we kind of just breeze over the religious spaces. um just like we were talking about paperwork, does your intake form ask about people's pronouns? Does it ask about their religious affiliation? Does it ask about all the other types of supports that they have? I know that, and it was also mentioned when someone was mentioning DBS. Um, I have a DBS social work assessment where the biggest thing that we're trying to acknowledge is, or tease out is, do you have the supports? Who are your supports? Let's identify them. Let's call them by name. Let's put them down in your chart, in your file somewhere. Do you have all the other social supports that you need? Do you have insurance? Are you navigating employment? Do we need to talk about FMLA? Do we need to talk about short-term disability? All these things. And that's why it's difficult for me to have conversations like this without people kind of ping-ponging back and forth, because there's a lot of nuances that come along, and me being able to speak to them as a social worker that I don't always have the luxury, but we'll have time for that in the Q&A. So key takeaways, this is a very short talk, so I hope that it'll allow us to get back on time. But I really am open to hearing some of the things that you guys have to say. But the key takeaways is that I want you to acknowledge, and I want to acknowledge, that it takes courage. It takes courage to be someone that is out as an LGBTQ individual. It takes courage to be a trans individual. It takes courage to navigate and waking up as a Parkinson's individual navigating Parkinson's disease and a care partner, to wake up and do this all over again. And I also want to point out, and one of your takeaways is that it's your definition. No one else can dictate how you feel and what your support system looks like, because ultimately it's your permission. You create what your space looks like. And again, leaning into the community, we are a community. We are not, as it was said, and as a good friend of mine always says, the individuals are not a monolith, right? So just because you met one LGBTQ person does not mean that that is your schema for all LGBTQ people. Just like if you meet a Black individual or meet a Latinx individual or AAPI individual, does that mean that that is your entire representation? And there's a lot of assumptions, as we talked about previously, but I also just want to acknowledge that this is, I'm sorry, the ice sounds like the ice cream truck is coming. So I also want to acknowledge that it's human first care. So just like when people say, oh, well, I didn't need to learn about LGBTQ plus because I treat everybody the same. That's a problem, because we know, historically speaking, LGBTQ people and individuals have not been allotted the same level of care that others individuals have had access to. Now, I do want to say happy Pride. This is my contact information if you have any follow-up questions that may not be answered in the Q&A. I'm not going to lie, this was a difficult talk for me to put together, though it is short. I hope that you guys got something from it. And the reason being is that because there's so many great speakers already. But this is it's hard to really help people build support without, because it's individualized, just like your care is individualized, right? So building your support system requires people to lean into sometimes spaces that are a little uncomfortable, and trying to help them figure out who might be already in your circle that could be a support to you. But with that being said, thank you for your time. Happy Pride. Again, my contact information if you would like to connect offline. Other than that, I think I am all good.